Hello, my name is Eduardo Huesca. I work for the Occupational Health Clinics for Ontario Workers, or OHCOW. This is a health and safety video developed for Ontario farm workers to share important information and resources on COVID-19. This video is number 2 of 3 and is titled What to Do If You Have COVID-19 Symptoms and Non-Emergency Healthcare. In this video, we will review the symptoms of COVID-19, how to report them, information about testing for the virus, as well as income support for sick workers. We will also review non-emergency healthcare that is available to you, including primary healthcare as well as mental health support. We have produced these videos for farm workers working in Ontario, Canada. There are 3 parts to this video, each sharing important information for you to stay safe and healthy during the COVID-19 pandemic. Try to watch all 3 videos. We share a phone number and an email you can use to connect with us if you have any questions or to let us know what additional information you may need. This video was produced by staff from the Occupational Health Clinics for Ontario Workers, or OHCOW. We are a network of 7 occupational health clinics found across the province of Ontario. We focus on supporting Ontario workers stay safe and healthy at work. We work with workers, employers, government, and community service agencies to achieve this goal. Since 2006, we have worked with farm workers arriving to work in Ontario. We travel to many farming regions, so you may have met our staff at one of our mobile health clinics or participated in one of our occupational health and safety workshops on your farm or at a community event or health and information fair. We also distribute information and resources to farm workers on how to keep safe and healthy on the farm. We also provide employer support to strengthen their health and safety programs and work and collaborate with many other agencies and organizations. Before we get started, we want to first give recognition and thank you to you and all the other farm workers. We want to start by thanking you for the work you do. We want to ensure you have a safe season and are reunited with family and loved ones in good health. We want to recognize and wish a safe recovery to the farm workers who are currently ill with COVID-19 and thank the healthcare workers who are looking after them. We also give our condolences to the families and loved ones of the farm workers who have passed away from this virus. It is very important we work together to stop future exposures and outbreaks among farm workers. As mentioned, this is the second video of 3. Here you can see the titles of the other COVID-19 safety videos. Each video provides important information for you to be informed and connected, so try to watch them all.
Hello, everyone. I'm Michelle Tu. I'm an occupational health nurse with OHCOW. In video number 1, we talked about the risk of contracting COVID-19 and the transmission of COVID-19. And I'm going to review some of that material here. So farm workers are at a higher risk of getting sick from COVID-19 for the following reasons. You live and work together in groups, so you have close exposure to lots of people. You share tools and you share transportation and housing at the farm. It's difficult to physically distance, both in the bunkhouse and also in workspace oftentimes. There's limited access to soap and water when you're working in the field, so the ability to wash your hands often is limited. There's also a risk of contracting COVID-19 from people who come to the farm, such as people delivering food or materials, or there may be temporary workers who are local as well. And when you travel to town for supplies and services, that also puts you at risk of contracting COVID-19, possibly from people that you encounter there. And symptoms may seem normal, and they may seem like allergies or heat effects, and so oftentimes it's not recognized. So what are the symptoms of COVID-19? COVID-19 symptoms are similar to other diseases, including heat stress, the cold, or the flu. And the most commonly reported symptoms in adults include fever, chills, a dry cough, tiredness or weakness, or just feeling unwell, new loss of taste or smell, joint aches and pains, sore throat, some GI disturbances such as diarrhea, abdominal pain and vomiting, a headache, and also conjunctivitis, also known by pink eye. There are more serious symptoms as well, including difficulty breathing, shortness of breath, chest pain or pressure, loss of speech or movement. And with these symptoms, you should get healthcare medical attention. In terms of diagnosis of COVID-19 and testing for COVID-19, that testing in temporary foreign agricultural workers has been recommended by the Premier of Ontario and or is requested by employers in some areas. Testing identifies who has the disease, as some people who have the disease may have no symptoms but still have the ability to infect others. It identifies where and how the virus is spreading. So is it spreading amongst a group of workers at your farm, or is it really more spreading more in the community? And that helps identify ways to control it. Getting tested is voluntary, so that no one can be forced to have testing, but there can be still consequences. For example, if you've been exposed to someone who has COVID-19 and don't wish to be tested, that it still may mean that you have to isolate for those 14 days. The test includes a nose swab, and as you can see in the picture, the nose swab goes fairly deep into the nose, and the person has to extend their neck back. If the test is positive, then you have to isolate for 14 days on the farm or other accommodations. And there needs to be regular check-ins or monitoring, at least daily, to see how you're doing. If symptoms become worse, you may need further health care and may need to be hospitalized. You also would be asked who you've been in touch with so that they do what's called contact tracing. So that's checking with others that you may be exposed to and suggesting that they get tested or monitor the symptoms as well. During this time, you will get paid and you will not be sent home. The testing is being organized by public health, and in many cases, it's at the workplace or on the farm. What should you do if you feel sick? If you have any of those symptoms that you think may be related to COVID-19 or is wondering, that you need to report or should report these symptoms right away. Tell your employer or your supervisor. Do not go to work. Isolate from your coworkers in a room by yourself. But if you are by yourself, make sure that you know how to call for help if you need it. Your supervisor should contact public health to report your symptoms and arrange for COVID-19 testing if this hasn't already been done. If you have severe symptoms, such as difficulty breathing, chest pain or pressure, loss of speech or movement, you should report it to your supervisor right away, who should call 911. If no supervisor is available, call 911 on your phone or have someone call for you. If your employer does not help by reporting these symptoms, then find someone that can help you report those. Either a clinic providing service for migrant farm workers in your area, or an advocate, or a community friend, or a coworker to contact public health or find medical care. There is a 1-866 number called telehealth, which you can also call. If you need to call an ambulance for a medical emergency, dial 911 from any telephone or cell phone. Any cell phone can call 911 as long as it can be turned on. So it doesn't matter if your phone is from home, from Mexico or Jamaica or wherever, and you don't need to have a paid plan. So any cell phone, as long as you can turn it on, can call 911. There are translation services available when you call 911 and ask for ambulance. Do not hang up. The 911 operator will connect you. Tell the operator what is wrong. Give your address and location if you know it, such as, are you in the bunkhouse or are you out in the middle of a field? And just know that all information is confidential. Also, just to know that you're eligible for emergency services even if you do not have your OHIP card. Income support if you're sick with COVID-19 or have tested positive. The Workplace Safety and Insurance Board in Ontario provides compensation for work-related illnesses or injuries. It's what is called a no-fault insurance system that can provide care and support to recover and be able to safely return to work. So what a no-fault system means is that it doesn't matter if, as a worker, you were supposed to do something differently, and you've been instructed to do it differently, but for some reason under those circumstances that a mistake is made, that doesn't matter in terms of the ability to collect compensation. So as a worker, you can collect compensation if there is an error on a worker's part, or if there's an error on an employer's side, that WSIB and compensation is available to you. All farm workers are covered, regardless of status. So if you have symptoms or have tested positive for COVID-19 and have been exposed to someone with COVID-19 at your work, you're eligible for compensation under WSIB. This includes income replacement, 85% of your average earnings, and also healthcare services related to your injury or illness, such as physiotherapy or hopefully not surgery, but any healthcare service that you may need. What to do if your employer doesn't support WSIB claim? It's against the law for an employer to discourage, reprimand, or fire a worker for reporting an injury or illness to WSIB. If that happens to you, then you should contact WSIB directly. And there's a 1-800 number to use here, and they have translators, so you can ask to speak to someone in your own language. There's also an email available here. Connecting or reporting to WSIB regarding COVID-19. So once you report your symptoms to your supervisor, that your employer should report this to WSIB. And WSIB has set up a number and an email service specifically to address temporary farm workers who experience symptoms related to COVID-19. WSIB then will give your employer your claim number, and they will also contact you for further information. And this may be done by phone or through your employer. Once WSIB has determined whether you're eligible for benefits, that they will inform you in writing whether the claim has been accepted. And this will be sent to you at the farm, but in a confidential envelope. If your employer has not reported to WSIB, you can report directly to WSIB using something called a Worker Form 6. There are a number of groups who may help you with this, and I'm going to outline who they are in the next couple of slides. So there is income replacement under other conditions as well. So if you've had a COVID-19 test which was negative, or you've not been tested but have to be isolated, you will still be paid. You should be eligible for either the Canadian Emergency Response Benefit, or you may be eligible for EI. So you have to meet the eligibility criteria for both of these programs. In terms of CERB, it means that you have to have an income from the previous year, and also that if you're going to be quarantined for 14 days, that you won't have an income over $1,000. If you've left your workplace due to unsafe conditions related to COVID-19, you may also be eligible for EI sick benefits or CERB. As with WSIB, reporting that you may need assistance when applying for these benefits. So where can you get assistance in terms of applying for income replacement support? I've listed 5 agencies here, and there may be others. But the first agency is a legal clinic in Toronto called OHCOW, and they answer their number in English or Spanish. The second agency is Justicia for Migrant Workers, and their number is listed here, and they will also reply to WhatsApp. Justicia for Migrant Workers does not have Spanish translation available. Migrant Alliance for Change has 2 numbers. One is English availability and one is Spanish. They both also will get messages via WhatsApp. Agricultural Workers Alliance is also a cross-Canada organization who also provides assistance to workers in English and Spanish. WSIB also has a 1-800 number, and they have translators to assist with questions. And so if you need a different language, just say that when you call this number and they will transfer you to a translator. So just remember that it's very important to report any symptoms you have to protect yourself and others. And the first people that it's suggested that you report to is your supervisor, your employer, but to report to somebody for sure. And also to talk to your coworkers about reporting any symptoms as well. So the next slides are going to talk about non-emergency health care. During this season, you may have other health issues which are not related to COVID-19, and you may need medical attention, as likely may have happened in previous years when you've been here. So some examples may be a shoulder strain, maybe heat exhaustion. You may have an infection, you may have high blood pressure, diabetes, or you may need a prescription for a medication that you need and take on a regular basis but have run out of. There are several clinics in Ontario that offer non-emergency health services specifically for international farm workers. Most have translators, and you can contact some of them directly through WhatsApp. They are offering services over the phone and in person if you need it. And I'm going to give you a list of their contact information in a few slides. For many services, you do not need to present your OHIP green card if you don't have it. That is specifically related to the health clinics that offer services for temporary foreign workers. You do not need your health card to access their services. There are other services, though, that you can access if you don't have one of those clinics in your area. The first one on here is, again, a telephone number that's referred to telehealth. When you call there's a long message at the beginning in English and French, and you need to wait for a person to answer and ask for a translator if you need one. Telehealth is answered by nurses who will ask questions and give advice about seeking healthcare in person, and may be able to assist with access to healthcare at other locations. OHIP cards are optional with telehealth. You do not need to give your OHIP number if you do not have one. In other areas, there are urgent care centers or walk-in clinics to help. Some walk-in clinics are open now, most are not, but the urgent care centers are open. And you may need help from your employer or a community advocate or a friend to assist with visiting these clinics. You will need your OHIP card for these services. There's also a large number of online non-emergency services that have opened up or have appeared online, shall we say, once all the walk-in clinics were closed. And so most of these services, the vast majority of them, are only in English. I have not found any that have translators. And what you need to do for these services is that you have to connect with them online. You have to fill in information online and provide your OHIP number. And then usually they call you back. And most of the assessments are usually done over the phone. But some workers have used them and have found them helpful. So here are the clinics who offer services specifically for temporary foreign agricultural workers, and they're listed by region. In the Beaverton area, the services are presented by the Brock Community Health Center, and the contact number is 416-886-4482. In the Port Hope area, the service is provided by the Port Hope Community Health Center, and their contact number is 705-808-3124. In Niagara region, the telephone number is 905-328-1546 via phone, text, or WhatsApp, and that service is provided by Quest Community Health Center. If you need one of these phone numbers, please pause the video and you will be able to write it down. In Norfolk, Simcoe Delhi area, the service is provided by Grand River Community Health Center, and the telephone number is 519-732-6375 by phone, text, or WhatsApp. In Delhi, the phone number is 519-586-2323, extension 269. In Chatham-Kent, the service is provided by Chatham-Kent Community Health Center. Phone number is 519-397-5455, extension 117. And in Windsor, Essex, Leamington area, the service is provided by Windsor Essex Community Health Center, and the telephone number is 519-997-2828, extension 503.
Many workers in the Seasonal Agricultural Worker Program have additional private insurance provided through Great West Life or Cowan. You will know that you have this insurance if you have a white card similar to the one in the top right-hand corner. There are also deductions off your pay for this insurance because you pay for it. In addition to life insurance and short-term disability insurance, it also covers some healthcare expenses that are not covered by OHIP. These include prescription drugs, medical supplies such as braces or physiotherapy services, which are often helpful in treating muscle strain or injury. Prescriptions, medical supplies, and physiotherapy services have to be ordered by a medical doctor. Treatment by a chiropractor or foot care by a podiatrist is also covered. Dental care due to an accident or emergency is also covered. And by emergency, this may mean a toothache that just comes on all of a sudden. Regarding ambulance services, there is part that is billed to the patient, and this is covered by this insurance. It might also cover other services or tests which may not be covered by OHIP, and these would have to be checked into. There are limits to the amount that is covered for all of these services.
COVID-19 has also created feelings of stress, anxiety, isolation, and or loneliness among many of us, even more so when we're away from family, friends, and loved ones. It is important to consider our mental health and know that we may all face challenges or ups and downs, and that this is nothing to be ashamed of. It is important to reach out for help when we need it. Some things to consider in support of your mental health include keeping connected to family and friends via phone or chat. Just make sure you disinfect your phone regularly. Recreational activities are important to disconnect and have some leisure and fun, but don't forget to follow COVID-19 safety precautions during recreation time as well. If your stress or mental health difficulty is coming from work or farm experiences, discuss this with your supervisor or employer, like you would with any other health and safety concern. Workplace stress and mental health, as well as harassment, are workplace health and safety issues. Reach out for help for mental health resources when you need to. We have tried to identify some mental health resources that you can connect to. Connects Ontario is a free service that will help you find mental health support in your area. You can call them at 1-866-531-2600. Let the person know where you are and they will help connect you with support. They can also serve callers in 170 different languages. We have also identified some additional mental health supports available in various agricultural regions of Ontario. So, for example, if you are in the St. Catharines or Niagara region, you can call 905-688-3711. For the Fort Erie area, call 905-382-0689. If you are in Grimsby or West Lincoln, call 905-563-6674. And for Port Colborne or Waynflete, call 905-734-1212. For the Windsor and Essex region, call 519-256-5000. And for the Durham region, call 1-800-452-0688 or 905-430-2522. If you are working and living in the Guelph or Wellington region, you can call 1-800-307-7078 or 519-824-2431, extension 27. If you are in the Kingston area, call 613-544-1771. If you are in the London Middlesex area, call 1-844-360-8055 or 1-866-933-2023. Feel free to pause this video to write down any of these numbers. We have also found a service connecting farm workers to conversational support with volunteers. If you're interested in connecting with the volunteer to chat, call us at 289-684-2821 and we will connect you. That concludes this video. If you have any questions about this video or if there's any additional information you need, give us a call at our OHCOW number at 289-684-2821 or email us at mfw@ohcow.on.ca. Thank you and continue to watch the next video.